Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action.
Welcome to the SRHM podcast. I'm Laura Ferguson, Associate Editor of SRHM Journal and Director of Research at the USC Institute on Inequalities in Global Health. And I'm really pleased to be joined today by Angela Baschieri and Martina Yopo Diaz, whose recent papers in the SRHM Journal explore the critical intersections between climate change and sexual and reproductive health and rights. So quick introductions. Martina is assistant professor at the Instituto de Sociología at Pontificia Universidad Católica de Chile in Santiago. And she's the lead author of the paper From Conception to Care, a systematic review of the impact of the climate crisis on reproductive justice, which was co-authored with Valentina Gomez Aguirre and Loretta Watkins. So welcome, Martina. And Angela is science leader on climate health impacts at the Institute of Environmental Science and Research in Auckland, New Zealand. And she authored with Chiagozi Uday the paper International Conference on Population and Development Programme of Action and Climate Action, an Intersecting Agenda. And we brought them together because their work highlights why climate change must be understood not only as an environmental issue, but as a matter of health, rights, and justice. So Angela, Martina, welcome, and thank you both for joining me today. So I wondered, just to start us off and set the scene a little bit, if each of you could briefly introduce your paper and let us know what motivated you to explore the intersections between climate change and sexual and reproductive health and rights. And if we can start with you, Angela, that would be great.
Thank you, Laura. Really pleased to be here and have this conversation with you and Martina. The paper was motivated by the commemoration of the ICPD. So we were discussing the 30 years anniversary of the ICPD Programme of Action and reflecting on the aspect of climate and where we came, how did it started, both the agenda, the UNFCCC was conceived at the same time of the ICPD, and the argument that we're trying to make on the paper is how those agendas are actually interconnected, that the same issue that the core principle of the importance of reproductive health and gender equality for sustainable development are important today as they were 30 years ago, and are also bringing principle of right that are critical for the climate action agenda.
Great, thank you. And Martina.
Yeah, thank you, Laura, for the invitation. And Angela, it's also a pleasure to meet you and to be here with you today. Actually, what motivated us to write this paper had to do with a more broad research agenda that looks into the remaking of reproduction and how we start to think of fertility and infertility as something that occurs not only within the body, but that is strongly shaped by structural factors and specifically about the environment. So we started reading about climate crisis and reproduction and noticed that ideas surrounding reproductive justice were largely absent. There was a lot of work focusing on reproductive health, but ideas of the right to have children, not to have children, and to raise them in sustainable and safe environments were rather absent. So we wanted to do a systematic literature review to outline what is already known, but especially what still needs to be known and acknowledged to further not only a research agenda, but also a policy agenda on how the climate crisis is reshaping reproductive lives around the world.
That's great, thank you. So I love that you've picked up this notion of reproductive justice and tried to bring it into the field of climate change, where you really felt that it was lacking in a lot of the existing literature. So what you did with this systematic review, you really looked at what is the evidence around climate change and reproductive justice. And I wonder if you could just say a little bit about what are the most striking or perhaps the most under-recognized impacts that you found.
Yeah, something that was really striking from our review was actually the absence of evidence regarding studies examining specifically how the climate crisis affects the right not to have children, focusing specifically on contraception and abortion. And this, which is a fundamental dimension of reproductive justice, it's an omission that reveals a critical and important blind spot in the literature. However, there were also impacts that are being documented that we were also struck by. And there, for example, we see how the climate crisis is reshaping the entire reproductive processes. And this is why we call the paper From Conception to Care. You know, it's the time from when you start conception until that child is born, and how his or her life is sustained through time. So it's not only associated with adverse pregnancy outcomes, such as increased fetal mortality, preterm birth, and lower birth weight, which are, of course, important impacts, but also with changes in reproductive intentions and practices. Many individuals around the world are choosing not to have children or have fewer children due to concerns about environmental futures. And also, just to mention another specific aspect, we also highlight the less visible but deeply important impact on parenting, which is something that is often neglected when talked about the reproductive impacts of the climate crisis. So here we see that the climate crisis introduces new emotional and psychological burdens, including eco-anxiety and distress about raising children in unsafe and unstable environments. And so, taken together, this finding shows that the climate change is not only a health issue, but it's also fundamentally transforming reproductive lives in different stages of the reproductive process. And that's the message we wanted to convey.
Thank you. Again, it's fascinating when you think of reproduction, you think of the biology, but also the social aspect. I mean, people's decisions around childbearing are very socially embedded. And so to bring that together and see that with climate change, there's an impact both on the biological processes, but also on the social attitudes around whether having a child, not having a child, raising a child. So it's great to see all of that coming out. Turning to you, Angela, Martina's work really looks at some of the life and health impacts that we're talking about in terms of climate change, SRHR. Your paper takes a step back to look at the policy level. So how do these realities that Martina's describing, how do they show up or perhaps fail to show up in global policy frameworks like the ICPD Programme of Action?
No, that's right. I think Martina kind of unpacked the kind of aspect of disproportionate impact on communities and on different life experience. So in the paper we look at more the policy framework. The principles are there. I think what we argue also on the paper is a lack of commitment and a lack of action on those principles. It's remarkable that an agenda that was set 30 years ago actually touch upon things that we still need. We are still kind of battling today to bring into practice. There is a lot of the discussion of in the ICPD, the principle, the right to development, the right of the migrant, the right of indigenous people, the right of the gender perspective of the climate action. They were all kind of highlighted in the ICPD, and they were also their commitment has also evolved over the last 80 years in the UNFCCC sort of conversation. In the context of the health, we have been seeing in the last 5 years more commitment with global declaration, a lot of the work spearheaded by WHO and many other constituencies. We have seen some progress on gender, although we're seeing by analyzing the commitment made by country that why certain ideas are recognized in principle, they are not followed by budget and allocation and actually action on the ground. So what we're seeing is that in principle things are recognized, but what we see in practice is that we are kind of lagging behind on the action agenda. I think we are coming to an even more complex reflection today of a political divide and a test on multilateralism, and I think it's just a good reflection on how we kind of bring back those principles alive, and how do we bring the social justice and human rights principle of equality and respect of how climate and other development action are kind of impacting people's life disproportionately.
Thanks, Angela. I think that's really important, and we reflect on the ICPD Programme of Action and the real focus on people-centeredness, as well as things like gender equality that really do come through. And like you say, we see that on paper in a lot of places. So I'd like to sort of keep with you for a minute and sort of take your argument about these principles a little bit further, because you argue in your paper that these principles from the ICPD should be guiding climate action now. And I wonder if you can just like tell us a little bit about what would that actually look like in practice. And that could be for governments, for international agencies, for civil society. Like there's a lot of different people involved. So if we really want to make this real, what does it look like?
No, exactly. So how will we move this in practice? I think just started to the right to health. There is a commitment from WHO to ensure that there are appropriate financing. I think we have moved the agenda on the health side. I think we are lagging behind still on making sure that SRHR issues are featured in climate and in health program. There is an aspect of ensuring that future generation are protected and right to environment. I think we are kind of lagging behind in practice. It means commitment, not just having on the governance aspect. So how do we make sure that voices are at the table, but they have a meaningful participation in conversation? And so I think, in terms of the youth, they've been driving a lot of the climate action. There are structure and system. I think what we need is more commitment and ensure that they have a meaningful participation on those conversations. So that's kind of another aspect. I think there is a major kind of agenda on migration that could be that needs to be reflected. There are not proper legal framework for the right to migrant. We are seeing from the Pacific, from many examples on really difficult conversation on how climate is impacting people's life, their culture. We're talking about some community of relocation. We have even an example here in New Zealand where certain areas are kind of flooded and the houses have been deemed not to be safe, and some people who are connected to the land, there are difficult decisions about a relocation and how we assist that. So that's I think we need to do more work on migrant and the whole legal and support framework that goes around that. And I guess the core point is it's at financing. There at the moment there is only a small percentage of the global financing allocated to SRHR issues. The global commitment on adaptation, we're also lagging well behind on fulfilling what are the required needs. We're still battling on some core issues of on the core principle of differentiated responsibility, where countries who have historically emitted have the according to the principle they have the honor to contribute more and resolve a kind of imbalance of historical imbalance. I think there more that needs to happen. I think we are coming to a very difficult global moment. And hopefully we're going to wake up from this period of with a renewal on core principle of humanity, really on rights and protecting of the environment, of the people, and in different contexts.
Thank you, Angela. I really look forward to waking up to that new political moment with all of those things happening. Because so much of this does rest on multilateralism and cooperation and collaboration among and between nations. And we know that is a particularly challenging situation at the moment. But Martina, I want to turn to you with kind of a very similar question of sort of the difference between what's on paper and what's happening in practice. And so I wonder from the review that you did, what are the biggest gaps that you were seeing between like what the evidence says and then what's actually happening in terms of policy or service delivery?
I think Angela's paper in that regard is much better tailored to address policy. But however, our findings do suggest some interesting insights regarding, how policies are today adapting to the challenges posed by the climate crisis. So our findings suggest that there are overall significant disconnections between the empirical evidence and how policies and services are being designed and delivered. While we document disruptions to reproductive health services, such as reduced access to antenatal care and postnatal care, unsafe births during extreme weather events, and barriers to healthcare due to displacement, for example, these realities are not adequately reflected in current policy frameworks. So reproductive justice overall remains largely absent from climate crisis adaptations. Health systems, in many cases around the world, are not designed to withstand climate-related disruptions, and there is insufficient attention to ensuring continuity of care, health care, and reproductive care in crisis context. So something also that Angela mentioned, and I think it's very important, and our paper also suggests that, is that policies also often fail to address the structural inequalities that shape vulnerability. Kind of that resonates very well with what Angela was mentioning about migration. So populations most affected by the climate crisis are also those who tend to face the greatest barriers accessing health and reproductive care, yet service models rarely account for this intersecting disadvantages. So I think that is a very critical aspect today in how policy can adapt and tailor to the needs of vulnerable populations in the context of the climate crisis.
Thank you. I think that's so important. You present in your review this huge mountain of evidence of all the different ways in which climate change is really affecting sexual and reproductive health and rights in so many different ways through so many different pathways. But when you look at service delivery and you look at the need for attention to structural determinants, that's still really lacking on the ground, which obviously has a huge impact. So, I think I'd like to pick up, if I can, on why we're lagging in terms of bringing together the climate crisis and SRHR specifically. And so I think, there's kind of a double question for you both. Sort of, why do you think SRHR is still often missing from, or at best marginal to, climate discussions, despite all this evidence that we're talking about? And what are the risks of that? If we continue to try and go down these parallel tracks, what are the risks that we're facing? And Martina, I'd love to start with you, if that's okay.
Yeah, of course. I think one very important aspect is that we still understand the climate crisis as an environmental issue, which is, of course, it is an environmental issue, but sometimes the connection that we fail to make is that the climate crisis actually is hindering the sustainability of life on the planet. So this is also, the creation and sustainability of life is at stake when we talk about the climate crisis. And I think this is a message that seems pretty obvious when you make it explicit, but it's sometimes not conveyed so often. Sometimes climate crisis and its impacts, which are hugely demonstrated in the literature, do not come across as relevant public issues that need to be urgently addressed and tackled. So I think, and reproduction is part of this phenomena that is often neglected when talked about in the context of the climate crisis. And I would have to say, and maybe that's even more specifically my experience with policy in Chile, is that currently policy agendas around the world are based on issues that seem to be more urgent: war, economic crisis, and other aspects that are as relevant and maybe with even more long-term consequences are often neglected or sidetracked, and they're not made a priority by governments, by the media, and then we see how issues that are so relevant are pushed to the side. So it's frustrating to see, as an academic, as a researcher, when you know the evidence and you know all the substantive and robust empirical evidence showing the significant impact that the climate crisis has, not only on sexual and reproductive rights, but also on the capacity to create and sustain life of the planet, that this issue is often so neglected compared to others. So yeah, I completely agree that this is an undergoing issue, and one that I would like or hope to see change, but I'm skeptical that that's going to be the case.
Thank you. Angela, let me pass over to you, see if you could help address the skepticism here.
Yes, I just to add to Martina, and it's not just an environmental crisis, and it's not a technical issue. So we kind of in the last 5 years, there's been many more research. Martina, in her review, she kind of review all this body of research, and even in the last year or so, the even more the papers or study or understanding of what are the issues are. So we know where are the issues, we know where the solution is. It's a political challenge. I think is how we bring views together and how we go back to the core principle. In many ways, going back to the principle of ICPD. How do we get is a 30 years old agenda, but is as relevant today as it was 30 years ago. And I guess it's the point that we are trying to make to the paper on core principle of rights and how, if we were to address them, we would make sure that those kind of policy and ideas and solution are put into practice. It's a political challenge.
It's one of the things that's really tough as a researcher when you have the evidence base and what you're dealing with is a political challenge, a communications challenge. Like, how do we compete with everything else that's going on in the world to try and persuade people to prioritize things that we see so clearly as like of critical importance to the world right now? So I did want to pick up on one other thing that I found across both of your papers is that you both highlight inequalities, gender, age, geography. So who is most affected at the intersection of climate change and SRHR, and why?
I think it's a question. If you want, I can
Please.
take the first. The challenge is that we are compounding vulnerability and we're compounding systemic aspect, and so it's not just is the migrant, is the woman, and which with in specific communities. So it's like the vulnerability climate amplify systemic injustice, amplifying challenges in different contexts, and that is kind of that intersectionality and that the compounding effect. And so it's a how do we take a broader sort of perspective to development and solution, and how do we bring the voices of those solutions to the table. And I think that's how the direction of how the global development, it's a recognizing how this the core importance of bringing people's perspective, people's solution to the table, and how do we shift the architecture in a way where we give the power and voices from those perspectives.
Absolutely, which I think was central to the ICPD Programme of Action, was centering people's voices. And maybe that is something that we can take advantage of in the current moment, because it is such a crisis. The global health architecture has been thrown into disarray, self-questioning, a need to redefine itself and restructure itself. And so hopefully there will be ways within that to try to better center some of the voices that have been lacking in more recent years. Martina, over to you on who's most affected and why.
Yeah, I completely agree with Angela's perspective. I mean, one thing that our paper shows very clearly is that the impact of the climate crisis is strongly stratified, and it intersects with, existing disadvantages and vulnerabilities. Particularly from an intersectional perspective, our findings shows that the impact of the climate crisis are very unequal. So I would say women and particularly pregnant women are among the most affected as they face increasing health risks and barriers to accessing care during climate-related events. Also, we find that children and young people are disproportionately impacted. They are more vulnerable to physical and psychological consequences of climate change. And in this regard, the psychological aspect is also important. You know, there's increasing evidence showing the anxiety and the stress that the younger generations are showing about the future. And this is also impacting their health and well-being. Our research also finds that marginalized communities, I would say in particular, Indigenous and Black populations, as well as those living in poverty, rural areas, or displaced contexts. Here, migration, I also think, is a critical issue, are especially affected. These groups are more exposed to environmental risk, while at the same time having fewer resources to adapt or access healthcare. I would say, you know, to summarize, that the climate crisis does amplify existing structural inequalities, limiting the ability of already disadvantaged populations to exercise their sexual and reproductive rights fully and equitably. So in a way, what we see is that the impacts of the climate crisis are not only stratified, but they also tend to enhance, you know, or increase existing and, you know, long-lasting vulnerabilities and inequalities.
Yeah. Thank you. I mean, I hear that same point from both of you very loud and clear, that climate crisis amplifies pre-existing inequalities. I feel like this is language that we heard a lot around the COVID pandemic as well, and recognizing that this isn't specific to sexual and reproductive health and rights. It's not specific to the climate crisis, that really to tackle any and all of these issues, we really need to be looking at what these structural determinants are that have shaped underlying and now compounding vulnerabilities. So let's think a little bit about moving forward. We've talked a little bit about already having lots and lots of evidence, which is great, but there are still research gaps. Martina, you identified some of those in your review. Could you tell us a little bit about what you think some of the most urgent research is that's needed moving forward?
Yeah, I mean, as you say, here there is a growing body of research showing the impact of the climate crisis on sexual and reproductive rights. However, there's still important gaps and issues that future research should address. I would think that there are three main issues. One, and it's actually something that it was quite shocking from the findings in our systematic literature review, is that the most urgent gap is the lack of empirical research on how the climate crisis affects the right not to have children. So basically, how the climate crisis and, you know, climate-related events and disruptions are affecting the right to access contraception and access abortion. So there's very limited evidence on how these issues are affected in climate disrupted contexts, and this is an area that I think requires immediate attention. There are two other issues that I would also like to mention because I think they're also important. One is that our study also highlights the need for more research in low and middle income countries. It's understandable, but at the same time, it creates a kind of bias in the available empirical evidence, because most of the studies regarding the impact of the climate crisis have been conducted in more developed countries of the global north. So here we see that the impacts of the climate change are often more severe, but remain underrepresented in the literature in those places, mainly developing countries from the global south where there's fewer research. So I think focusing on these geographical areas is very important to move the research agenda forward. And last, I would like to say that there is need for more intersectional research that captures how factors such as gender, race, age, and socioeconomic status shape vulnerability. There is, for example, pregnancy, as we discussed before. There are other sociodemographic variables, but a more intersectional perspective should be pushed. And also, there are other unexplored areas that, particularly in the context of fertility decline, become really important to address in the context of the impact of the climate crisis on reproductive justice. I'm here and thinking specifically about how infertility, assisted reproductive technologies, and the ways in which individuals and community adapt their reproductive lives in response to environmental change. I think these are issues that have also been rather neglected in research. And since they're becoming practices that are more and more prevalent, we need to look how the climate crisis is also disrupting reproductive processes related to infertility, as well as the access to technology to be able to conceive and bear children. So I think those are areas also where I hope to see research in the future.
That's great and really interesting. I think there's a lot of work going on right now in the field of measuring reproductive agency. So, one's ability to align behaviors with fertility intentions, be those to have a child or not to have a child. And so thinking about the data that you need to be measuring reproductive agency and how that intersects with climate, I think will be a really interesting piece that will be important moving forward. Angela, can I turn to you also on this forward-looking question? From the policy perspective, what do you see as the top priorities for really helping to align the climate and SRHR agendas globally at this point?
I think it's all come down to financing and commitment. I think we need to really resolve the global financial architecture and now how that affects climate, allocation on adaptation, allocation on health, allocation on sexual reproductive health and right. And there are opportunities in the the NDC cycle, as we some countries have submitted, or they are in the process of it, and I think there are opportunity at country level to engage on those kind of national conversation, civil society, young people, and all kind of party can really influence that kind of national commitment. It comes down to financing and how we really bring the action to ideas and to policy and implementation. So I think that's kind of the major challenge going ahead.
I think it's a huge challenge, but I think in a sense we also have two entry points for it. We have the climate entry point and we have the sexual and reproductive health and rights entry point. And so if we can be looking at both of those avenues as ways to be trying to mainstream and get finance allocated, hopefully we can slowly start to make a difference in both spaces. So we're almost out of time. I wanted to see if we could end. I'd love just a few reflections from you both. Like if you could change one thing in how the global community approaches climate change and sexual and reproductive health and rights, what would it be? And Angela, I'll let you have your wish list first.
If I have my way, I will definitely change. I think it's how we bring everyone with the same perspective, and we adopted a kind of principle of equality and right, and almost like how we get back to the ICPD sort of the moment where historical moment where we got country to agree on an important declaration, and so how do we renew that kind of collective action and collective vision? And I think that's what is needed more today than ever, how we renew our commitment to each other, to the environment, and to community, and to everybody who is on this planet. And so I think it's how we will bring that kind of collective spirit and share a vision on where to go next.
I love that, a vision for a shared humanity again. Martina, over to you.
Yeah, it's a challenging question, but I guess it's inviting to think if we could shape the future, how we would like that future to be. And I guess if I could change one thing, it would be to ensure that reproductive justice is treated as a central component of climate policy and adaptation strategies rather than a peripheral concern. We see governments across the globe panicking literally about fertility decline, about the fact that there are not enough children being born to sustain economies and societies. But then we need to link those concerns to the environmental futures that these children and families are inheriting. So we need to connect these concerns, for example, about fertility decline to environmental futures and environmental sustainability. So to enhance actions that will enable to create more sustainable futures where actually people are able to enact their sexual and reproductive rights, which sometimes do involve, wanting to have children and raise them in safe and sustainable environments. Another point I think it's important to bring up is that our findings do make clear that the climate crisis is significantly disrupting people's ability to have children and to raise them in safe and healthy environments. And addressing these challenges, I think, requires integrating sexual and reproductive health and rights into climate responses at all levels. I think this is a very important matter that should be at the forefront on how governments, and organizations are tackling this issue. This means then designing climate resilient health systems, ensuring the continuity of reproductive care during crisis, and supporting both individual and communities to adapt to changing environmental conditions. Ultimately, in a way, this means safeguarding reproductive justice and understanding that this is essential to building more sustainable and equitable futures. In a way, what's at stake here are human rights and our right to live equitably and safely in this beautiful planet that we inherited. So it's a major issue, and it's some that I hope to see more involved in policymaking in the coming years.
Thank you, Martina. I so love that because in a sense you've brought us full circle. We're back at the ICPD again, where we're dealing with sexual and reproductive health and rights and helping people make informed choices so that we don't have a population policy that's driven by wanting to increase or decrease fertility, but that we're looking at how do we help people make informed choices and what is the environment that they want to have to live in within which they make those choices. And I think that both of your papers do a lovely job at pulling out all of those issues. So Angela, Martina, thank you so much for joining me today and for your thoughtful and important contributions to the SRHM Journal. And to our listeners, thank you for joining us. We warmly encourage you to explore the SRHM Journal and to consider submitting your own work to our open issue, which welcomes contributions on all topics related to sexual and reproductive health and rights, including emerging and critical issues such as climate justice. And you can find out more at srhmjournal.org. Thank you.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautond.